We are live.
Yes.
It's live now. So welcome. My name's Linda, and we also have Lisa here. We're going to be presenting to you on hypnosis for fertility and birthing. The presentation we're going to be giving to you in a moment is one that we did this past January for World Hypnotism Day. We wanted to record it so that people could watch it ongoingly. So that more people could see it, because not everybody was able to attend our event. We have World Hypnotism Day every year on January 4th, so do look out for announcements around that. But we're going to give you our talk on fertility and birthing. And Lisa, what would you like to?
Linda and I have both passionate in our field of hypnosis. And we've been professional hypnotists for a number of years. And we hope that you actually gain some knowledgeable information from our presentation of infertility and hypnobirthing. And we hope that you enjoy it.
All right. So we're going to now screen share for you so you can see our slide presentations. In a moment, we'll.
All set, I think, there.
Yep, you look live, so.
Great.
All right. Let's move to your next slide. All right, I'm going to introduce to you Lisa Evans. She is a certified consulting hypnotist, and she's been a member of the National Guild of Hypnotists since 2010. She's also a licensed board-certified massage therapist. She has many advanced certifications. She has certifications in hypnobirthing, using hypnosis for childbirth, mind-body fertility connection, which is hypnosis for fertility, training your brain to adopt healthy habits, Arvigo Maya abdominal massage techniques, and she's also certified in hypno-coaching, which is a combination of hypnosis with life coaching techniques.
Thank you very much, Linda. Well, we are presenting on hypnosis for fertility. I'll be presenting that, and Linda will be presenting more on hypnobirthing. And it's important to note that infertility is defined as an inability to achieve a pregnancy after 12 months of unprotected intercourse. And research has shown that hypnosis can be a valuable tool. We have both recognized that there is a great need for health education and well-being, because the rewards of using your own inner ability for healing has successful outcomes. As you can see on this infertility slide, that hypnosis, the mind-body, the typical success rate is 42 to 65%. Now that percentage rate has come from a couple of years ago, but those success rates, it's important to note, are full-term pregnancy, whereas the medical profession's success rate from 3% to 25% are not full-term pregnancies, and we'll address some of that later. There are many studies that have been established that the use of hypnosis has an impact on our cellular response, especially as it pertains to the challenges of infertility, pregnancy, and birthing. And because we live in a world where it seems that our health has taken a step backwards, it's just too easy to medicate ourselves, as there is a lack in the quality of our stability to attain a level of calmness that simple hypnosis can offer. The scientific studies now show that for some couples, they can have a much greater chance of conceiving if they participate in one of the mind-body healing programs. It's a lifestyle of using healing modalities such as hypnosis, Arvigo, abdominal massage techniques, chiropractic, and even acupuncture. And again, it's important to note that the infertility is defined as the inability to achieve a pregnancy after 12 months of unprotected intercourse. And research has shown that for some couples, the biggest obstacle to conception in full-term pregnancy after trying to conceive for 1 year is stress. Stress is the main reason that our autonomic nervous system runs amok. And the success of these healing modalities are based on changes made to the nervous system, which Linda will be covering a little more about the ANS in detail as she covers the hypnobirthing. But let's talk about stress for a minute. Some of you may relate to some or all of the situations, as some people tend to overact while others may not. Stress for many of us is like pleasure and pain. Like the pleasure of our first kiss, but having sex for the first time could have been very awkward. And we love planning and taking trips, but for some of us, we may hate flying. It's rewarding buying a new home, but it's very stressful selling a house and moving into another. And as you can imagine, that's what it's like for some couples trying to have a baby. Some people can pop those little ones out and no problem at all, while other couples are very envious. And we all know what pleasure intimacy should feel like, but when our mind is consistently anticipating that sperm and egg meet in connection, it can be very stressful. All of that stress is building up in our corresponding hormones, basically sending the signals from our brain to our ovaries, saying that this person is too stressed to reproduce at this time. Something is just not correct and it doesn't feel romantic enough. When a couple is stressed, it can take several conditions that can interfere with conception and full-term pregnancy. The effects of stress directly influences the physical functioning of our reproductive system by creating reproductive imbalances. For follicle production, it disrupts our glandular function. It creates interruption of our hormone levels and its functioning, and inadequate urine blood flow. And this is not always the women's stress levels, because men, approximately 30 to 40% of infertility can be due to a male factor. And that's what researchers have finally concluded. But how do we reduce our stress levels? We adapt a healthy mindset using the Mind-Body Healing Program. Both men and women can have successful outcomes when trying to conceive. As one happy couple found out, when they came in, they were in need of balancing careers and reproducing and reducing the symptoms of irritable bowel syndrome, and they found hypnosis to be very successful. In another case, they had a woman that came in. She was referred for a relaxing massage to reduce her stress levels in hopes of becoming pregnant. But through further consultation, we realized that she would benefit from a Arvigo Mayan abdominal massage. This massage can reproduce and reposition her organs for inadequate blood flow. It would increase her chances of reproducing. Our Arvigo Mayan abdominal massage goal is to ensure that the uterus is in the correct position. It repositions the organs that may have dropped and restrict the flow of blood and lymph, nerve, and energy. It's another way to restore balance in the body, because having restricted blood flow or old blood may indicate the uterus is tilted. Women athletes or over-exercising, surgeries, and accidents can cause misalignment in our uterus, affecting homeostasis. And just imagine how increasing oxygen and blood supply will increase your chances of reproducing, or even healing from injuries from that matter. The entire mind-body approach of being taught self-hypnosis helps all of us connect. We connect and we can reprogram ourselves at a cellular level. And I have found that when we reach a certain level or plane of mental and physical relaxation through hypnosis, that electrical and biochemical changes can occur within our physical body. Changes that have both a relaxing and healing effect on our entire internal system, helping couples change emotional blocks that may be manifesting, such as fear of failure and disappointments, and the memory of significant loss may resurface in upsetting and distressing ways as a woman enters motherhood. They are taught how to change their self-talk to improve on positive changes for what they really want, and in this case, it's to conceive. And yes, we can reprogram our negative thoughts and/or our beliefs, changing our self-talk. The connections of our mind-body program can help couples become pregnant at very early stages with the features of guided exercises for meditation, self-hypnosis and visualization, the tools and techniques for reducing stress and producing the processes of issues that might be blocking conception. It revitalizes self-esteem issues and builds the belief system around getting pregnant. In reality, if the inner mind is intelligent enough to keep us breathing and our hearts beating while we sleep, and it knows how to keep us alive, then it certainly must know where to send the proper messages or signals, the chemicals and hormones that we need to balance and heal ourselves. And the infertility treatments, again, for the mind-body programs have success rates of 42 to 65% of full-term pregnancies.
You all done, Lisa?
I'm all set. And
All right.
now I'm going to be introducing Linda, who is going to be talking about the hypnosis for the hypnobirthing.
Mm-hmm.
Now, Linda Donalds is a board-certified hypnotist. She's a certified instructor for the National Guild of Hypnotists and has been a member since 1998. She has many advanced certifications, including the HypnoBirthing, which is hypnosis for childbirth, the Hypnofertility, hypnosis for fertility, complementary medical hypnotism, hypnosis for pain management, diabetes, emotional, motivational hypnotism, hypnosis for irritable bowel syndrome and fibromyalgia, and stress management consultant. Linda has personal hypnobirthing experience when using it with her daughter.
That's right. My daughter is now 7 years old, so I did do hypnobirthing when I gave birth to her. I figured being a hypnotist for so many years, how else was a hypnotist give birth but using hypnobirthing? I'd heard about it for many years, and I have personal experience doing just what I'm going to talk to you about now. So the hypnobirthing philosophy, I'm going to start with that. The hypnobirthing philosophy is that birth is natural, normal, and healthy. And birth has a natural rhythm and flow. When a healthy woman carrying a healthy baby, experiencing a healthy labor, trusts the birth process and is free of fear and is appropriately relaxed, her body will function normally without pain or incident. And this is the philosophy of the hypnobirthing class. The hypnobirthing classes were created by Marie Mongan, and she had, in her normal physiological process, does not need assistance. It needs only the patience of birth attendants to resist the temptation to disturb its rhythm and flow in the absence of any special circumstances. And so Marie Mongan, who founded HypnoBirthing and created the program that both Lisa and I teach, where she began with creating this program was with her own personal experience of birthing her children. And she had a book that she used as kind of the way she learned about childbirthing comfortably, naturally, and used that as the beginning of the course. The book was called Childbirth Without Fear, and it was written by a British surgeon named Grantley Dick Reed. Grantley Dick Reed traveled abroad a lot in his work, and he experienced on several occasions women who gave birth naturally without any pain. And one of these mothers asked him afterwards, because it always surprised him when he experienced these, but one of the mothers said to him, "But doctor, it didn't hurt. It's not supposed to, is it?" And that always was something that really interested in him, because in what he knew about anatomy and birthing, he couldn't understand why it would actually hurt and what it was that caused these women to not experience pain, because he knew that that was common for most of the other women that he observed. It was just these certain women. So he began to ask himself, what is it that these simple women, uneducated women, brought to their birthings that allowed them to birth so easily and comfortably and without trauma? And he realized that it actually wasn't what they brought. It was actually, when he thought about it, it was actually what they didn't bring. It's what they didn't bring. They didn't bring fear. So let's talk a little bit about fear and what happens when somebody has fear. Fear, when your body is experiencing fear, when the mind is experiencing fear, it creates tension in the body. And when there's tension, muscles are constricted. They can't do exactly what it was that they were designed to do. And in certain cases, when a muscle needs to relax and it's being tense, it will create pain. We call this the fear, tension, pain syndrome. And when you're experiencing pain, that can cause more fear and more tension and more pain. It becomes a cycle. The source of pain is tension caused by some degree of fear or apprehension. I'm going to talk to you a little bit about the autonomic nervous system. I saw this slide a little earlier when Lisa was presenting, and I'm going to elaborate more on what the autonomic nervous system is, because important role in what happens in the body when fear is present, and also when fear is not present. The autonomic nervous system has two parts to it. It has the sympathetic nervous system and the parasympathetic nervous system. Now, when you have fear, that fear, tension, pain syndrome I was just talking about, when you have fear, you are activating the sympathetic nervous system. It's a part of the nervous system that responds when something feels fearful and that you need to defend yourself. It's when you're stressed. We also refer to it in hypnobirthing as an emergency situation. And for every thought or emotion, there is going to be a corresponding chemical and physiological response within the body. When we perceive danger, the body responds. It responds and sends out chemical signals and makes a change in the body using the sympathetic nervous system. Now, when we're not perceiving danger, when we feel confident and calm and everything seems fine, when we're relaxed, that's when the autonomic nervous system engages the parasympathetic nervous system. First, I'm going to talk to you a little bit more about the sympathetic nervous system, because this is the key part of the nervous system that deals with fear and stress. So when you are feeling fear, you activate a response in the body. You may have heard of this before, of the fight or flight response, or often it's also called the fight or flight or freeze response. And so when your body is in that response mode of fight or flight, there's some danger going on, something's an emergency, a fear, your body responds by increasing the heart rate, the blood pressure rises, you'll be breathing faster, but you'll also be breathing more shallow. And the body is going to redirect the blood flow to defense muscles. That blood flow brings oxygen and nutrients. And so it redirects it to the defense muscles so that you can defend yourself against whatever that danger is. Because we need to get into action very quickly and we need energy for these muscles, including the heart and all. It's also going to bring up, elevate the blood sugar levels. Your digestion will also slow down because it actually just doesn't matter whether you digest if you're being chased by, say, a bear. It doesn't matter if you digest your food, so that all slows down, even stops. And the eye pupils also dilate. So these are the responses that your body has. Men, women, doesn't really matter, but if you're in a fear mode, in a stress mode, these are some of the things that your body's responding with. Now, if you happen to also be a woman who is pregnant and you're nearing the end of your pregnancy and it's about the time that you might be expected to go into labor, well, that fear mode, that fight or flight response is also going to affect how and even whether or not you go into labor. So these are some of the additional things that would happen to a woman at the end of her pregnancy in that fight or flight response. The uterine muscles will constrict. Now, there are different layers of muscles in the uterus. Some of them do constrict normally during regular circumstances, but some of them need to relax. But in the case of the fight or flight response, the muscles will all constrict. The uterus will also become oxygen deprived. And pain will get created, particularly because certain muscles are actually supposed to relax. And if they're tensing up, you'll get that pain, that fear, tension, pain I was talking about a little bit before. Now, because the cervix is all tightening and the uterus muscles are tightening, you're also going to create fetal distress. Your baby's going to become distressed. The baby's going to have a limited oxygen to it, and the fetal heart rate will decline. And also because the muscles aren't working the way they were designed, labor will become prolonged. Now, of course, the doctors and the nurses that are observing all of these responses in the body, they're going to declare that you're failing to progress. And they're going to want to jump in and intervene. They're going to perhaps want to do an induction if you haven't already gone into labor, or augmentation if things aren't progressing fast enough on their time scale. And they might even go for surgery, doing a C-section. Now, that failure to progress has a FTP. Well, FTP also happens to be the same acronym that we use for fear, tension, pain. So when a woman is failing to progress during her labor, it is actually the case that she has engaged her sympathetic nervous system as a result of the fear and tension and pain, that fear element. So the best thing for a mother to do when she's failing to progress is actually identify the fear and release it. It's a lot of what we work on in hypnobirthing is releasing fears. So let's take this scenario of birthing differently with the parasympathetic nervous system. So the parasympathetic nervous system is that part of your nervous system that is engaged when you're calm and relaxed. Everything is normal. You feel safe and secure. In this case, with the parasympathetic nervous system, your blood flow will flow normally to all areas of the body, not just the defense muscles, and they're not necessarily needed here because you're not trying to defend anything, but now the blood flows normally to all areas of your body. Your heart rate and your blood pressure are normal. Your food gets digested normally. Your uterine muscles are functioning as they were designed. And so oxygen and nutrients are getting to the uterus as they should. And of course, if the oxygen and nutrients, that blood flow, bringing them there is working just fine, then of course baby is also going to get the oxygen and nutrients that baby needs. Mother is going to remain comfortable and confident, and also baby will be comfortable. The first and second phases of your labor are going to be shorter. Everything's working the way it was designed, so everything will move along and progress the way it should, and labor should be shorter. Now, the need for medication is often reduced when we're birthing in this calm, relaxed way. And I have found that often cases with the mothers that I have taught hypnobirthing to, that need for medication is often eliminated. They don't need the medication. And also, because everything is working just fine normally, all the right ways it should, your immune system remains strong throughout this whole labor. And so afterwards, you have a quicker recovery after birth. You're up and around, have plenty of energy, you feel great. A lot of my moms that I teach this class to report that quite frequently. Now, when you birth with the parasympathetic nervous system, this calm, relaxed, normal way, during the birthing and afterwards, the moms and the babies are happy and healthy. And of course, when mom and baby are happy and healthy, dads are as well. So everybody benefits from this experience as being happy and healthy. Now, the rationale for a gentle, comfortable birthing is not a new concept. It's actually something that can be dated, I'm not sure how far back in history, but we know that it has a written record going back as far as 1891, when Dr. Jonathan Dye said in one of his books called Easier Childbirth, he said, according to physiological law, all normal natural functions of the body are achieved without peril or pain. Birth is natural, normal, physiological function for normal, healthy women and their healthy babies. And so therefore, it can be inferred that healthy women carrying healthy babies can safely birth without peril or pain. So this is a doctor back in the late 1800s that was the first one that wrote this down in a book that he wrote. And then we had Grantley Dick Reed, who also said the same or similar things as well. And so this is not a new concept that we can birth comfortably without any pain. This is not new. It's just something that in hypnobirthing we have looked at history from these two surgeons and learned from them, as well as other methods as well, and put together a program so that you as well can have this experience. So here's what parents will learn. And I'm not saying just moms, because dads take the course, the hypnobirthing course as well. So this is what parents will learn. Learn how mother's body is designed to give birth, what those muscles are designed to do in the whole body, where your fears come from, and how labor. Now, I talked a little bit about how fear affects labor, but in the hypnobirthing classes, I elaborate much more on that, the effects of it on the body. And we talk a lot about where these fears actually come from, and we do many fear release exercises throughout the course. That's a very important part of hypnobirthing, is to release fear. And you're going to also learn hypnotic relaxation techniques, breathing techniques, imagery and visualization techniques. There's also a good bit on how to bond with your baby before your baby is born, while your baby is still in the womb. And fathers play a very important role. So fathers, partners of the mother, birthing companions, will learn a number of things that they can do to be supportive throughout the labor. Parents are sent home with many exercises to practice, and also audio recordings. So there's practice between each of the classes, and then ongoingly afterwards throughout the rest of the pregnancy and through the labor as well. Now, the HypnoBirthing Institute has done a lot of efforts to connect with parents who have taken this course, to talk with them, and also through surveys, and have collected a lot of information about the outcomes of our program. So that what I'm going to share with you is supported by evidence. We know that with hypnobirthing, there are fewer preterm and low-weight babies. There are fewer cases of preeclampsia and of hydration. There's a decreased use of medications to induce labor. The first and second phases of labor are shorter. There's a lessened or even an eliminated need for pain medications. And I know that this is true because I have talked with most of the parents that I have taught this class to, and the moms many of the moms that I have taught this program to have achieved a natural childbirth without any pain medications and all. They didn't need them. There's also decreased need for artificial rupture of membranes, fewer interventions and fewer surgical births. And again, I've had even my moms report repeatedly how babies are much more alert. They're very alert right after birth. They haven't been medicated, so they're very alert. And they're able to nurse their babies almost immediately. Infants have a higher than average APGAR score. And there's been no cases of postpartum depression reported. So what we find is that we have happier and content mothers and babies. And as I said before, when moms and babies are happy and content, well, dads are as well. So we have happy families. They're very pleased with the results and what they got out of doing this program. And so you might be a mother who is expecting a baby right now, or maybe you would like to be a mother who's expecting a baby. Maybe the part of this presentation that has interested you is how hypnosis can help with fertility. But at some point you may wish to take this class and you might wonder, well, when should I register? And I always tell moms that they should register sooner. Sooner is better. As soon as you find out about the program, find out where it's offered and sign up for it. Sooner is better because you have more time to practice the techniques between the time of learning them during the class and all the way through your pregnancy and up to labor. And you'll have more confidence. You'll be more excited about your birth experience that's coming up. You'll be anticipating giving birth with excitement and confidence. And that's very beneficial to go through pregnancy that way. And there are many health benefits, not just to mom, but also to baby, both of you, for reducing stress throughout your pregnancy. We've talked about the effects of stress on the body, both Lisa and I have, and so you have many health benefits for learning these techniques throughout the rest of your pregnancy. And so since the course is a 5-week program, each of the classes are 2.5 hours each, it's best to start the class no later than week 30 of your pregnancy. And if you're finding out about this program later and it's not feasible for you to start by week 30, definitely do contact either myself or Lisa, because we may be able to arrange a private class for you to take it in a shorter time frame and get it completed in time before your baby is expected. And so this is the end of our presentation, and we would love to have questions and to answer any questions you have. We know that you're listening to this as a video replay, and so to give us a call, contact us with your questions so that we can answer them. My name again is Linda Donald, and you can give me a call at 508-246-2721. And my website is www.newhorizonsinhypnosis.com.
Thank you again. And my name is Lisa Evans, 781-963-2901. Or my website is bodymaintenanceplace.com. Thank you.
So we're going to stop the screen share. So you can see us again. And so we thank you for listening to our presentation. We hope that you found the information interesting and useful. And again, if you have any questions at all, just give one of us a call. We're most happy to answer any questions you have. We're very passionate about these programs and about hypnosis in general.
And this presentation was recorded on April 17th, 2015. Hypnosis for Fertility and Birthing with Linda Donalds and Lisa Evans.
Thanks very much.